Hello to all my fibromyalgia friends. I am so thrilled to have this interview set up with Jacqueline from the Fibromyalgia Support Network. It is long overdue, and I'm just thrilled to have her actually discuss all of the work that her and her group of tremendous advocates are doing over in the network and bring her on for some interviews on what she got started. And you'll definitely be seeing more content. Please join all their activities. We'll be sharing more on all our social media platforms moving forward. I am Melissa Tolwar. I'm the executive director of the new name of the Fibromyalgia National Health Organization, and I'm excited to be here for the interview. So let's get started with this. I do want to just have you make an introduction, a little introduction, but also then lead into what inspired you to start the Fibromyalgia Support Network for us.
Thank you, Melissa. And first of all, thank you for having me here with you today. And hello, everyone. So my journey with fibromyalgia started back in just after my son was born. I would say in 96, 97. I was not diagnosed at that time, but I started having chronic pain, odd pain in my back, random pain. The issues started to grow from there. And I finally got diagnosed formally by a rheumatologist at that time in 2003. I went on a 56-week drug trial with Cymbalta at that time, and that's 20 years ago now. Cymbalta was not a drug that was approved nationally in Canada as well in the States. So this was a North American trial. I was part of that study, and it was a result of that study that the drug was approved for use for fibromyalgia. And I was working full time and had been working full time since I was 18. And around 2007, things came to a head where really I started facing a choice mentally and emotionally about holding a position. My experience has all been in executive administration, so I was running the office of the principal at a university institution here, but I was also on the executive board, and I was also on the secretary of this corporation. I had multiple hats. I was the events officer and did things like commencement ceremonies as well as convocation, and it was a one-person job. So there was a lot on my plate, and I started to feel myself drowning, if you can picture treading water and trying to keep your head above water and just having to struggle. I learned a very valuable life lesson through that process in 2007, 2008, which was if you don't listen to your body, which I really wasn't, to be honest, because I was working 50, 60-hour weeks. If you don't listen to your body, eventually your body will take over. And so in February of 2007, my body shut down. I literally was bedridden for 3 weeks. My husband personally thought I was dying. And that started me on a whole gamut of different medications, from tramadol to gabapentin to amitriptyline. Like, the doctors were doing their usual trial and error, what works for you, what doesn't. So I've tried everything all the way up from Lyrica to Sesamet. And it was at the time when I was taking Sesamet, and this is over a period of a year or 2 years, which is a derivative of marijuana. It changed my personality, and I was angry all the time. And after 4 months of trying it, I said, I've had enough. I'm not going to take this anymore. And since that time to now, I've just settled and accepted the fact that I have to take, because there were times I tried not to take, which I'm sure many of you, when you start to feel better, you feel, I don't want to take medications because I don't want to become addicted to anything or be one of those people that have to take medicines all the time, and your body will push you back to the reality. And so I've been taking Cymbalta is known as Deluxetine in its generic form, and I've been on that since that time to now as one of my pain meds that I take for my symptoms. What led up to starting a fibromyalgia group was actually, to be honest, when I was going through counseling, the counselor had said to me, there's no fibro group. If you're saying there's no fibro group in London right now, why don't you start one on your own? And I sat on that piece of advice and chewed on it for a couple of years until November 2014. I decided to stop thinking and start doing. I invited people from the area. I didn't know them, but I put an ad out there and got a group of people living with fibro together for a lunch meeting. And from there, that was the genesis of the idea of setting up a support group. And basically, I started the Fibro Support Group, which was called at that time Fibromyalgia London Group. And it started from there and evolved to what it is today. The Fibromyalgia London Group would have their monthly meetings, and we started getting to know different local speakers, having certain special events. And come 2020, we went through the pandemic, and that forced our growing group to pivot because to respond to membership saying, my gosh, I already feel isolated. I feel lonely. I'm already disconnected from so many people now. COVID is forcing us to be further isolated, and they were worried about their mental health, worried about, pretty serious effects from it. So we pivoted, not knowing anything about Zoom, and forced ourselves to learn it in 2 weeks, and started with a couple of programs which were meant to just be connections. And the programs grew, and then we found there was this thirst for connection. There was this thirst for education. There was this thirst to be able to feel part of something, to have a sense of belonging. And so it grew from there. So COVID-19 may be a lot of bad things, have done a lot of damage to a lot, in people's lives, but it did help us, as an organization to respond and grow. And from that time on, we started noticing that people from outside of this area were joining us in need of it. And we've always been an inclusive organization. So we've grown from local to regional to national, and more recently in the last 2 years we've grown to international. Up until now we've always considered the US as part of us, so it's part of this continent. And so we had people from the US and have people from the US as part of our community, but now our community has expanded across oceans, and we do have people in the UK that attend some of our functions, or they get the recordings and they watch that. They've participated in stories in our book called 50 Shades of Fibro, which was a book on telling stories from different people who all live with fibro or are carers of people with fibro, sharing their personal journeys. And in fact, several of those stories are from people who live in the UK. So that's the genesis of how our group started. And in just to wrap this point up, in September 2003, we changed our name to better reflect our organization and what it had evolved to, and therefore Fibro Support Network became the name we adapted and continue to use.
I am just so impressed by the growth. And you're absolutely right. I mean, going virtual has helped our community grow so much through something that was unfortunately painful for everybody across the world. We've really been able to connect virtually in a whole different way and continuing all of that. But your programming has just amazed me. And a funny joke, it's just funny it's an inside stuff that we had to both go through. But doing this was our organization names were so similar. Because we were the Support Fibromyalgia Network, and you're the Fibromyalgia
Fibro Support Network.
That people online kept sharing and would tag us. And I was like, I would love to take credit for this amazing work, but I can't. So we need to. And it was but it kind of showed me, I was like, because we're talking as a group, we have to go into all of the details and stuff. And I know there's a lot of different groups, but I think it's just you've advanced this education need, because I want to make sure that people know it's not just a support group. There's education, there's workshops, there's activities and creativity, journaling, chair yoga. It's vast and it appeals to a variety of different personalities and different interests. And across the world, it's virtual.
When we pivoted to the virtual, right, and I started, as I mentioned, we started having a couple of support groups sessions online, but it grew from there because people were voicing about, I'd love to have games, it would be nice if we could play games. Okay, so we started games. Then that evolved to, people who could knit. Happened to be, we have a person and we still do, Janice Sumpton. She's a knitter extraordinaire. She's had her work on runways in New York during Fashion Week. It became a way to tap into the many talents, gifts, and skills that people with fibro have. And your journey with fibro and that diagnosis sort of left them feeling, what do I do now? How do I live life? And what purpose do I have? And I'm sure many of you, if not all, can relate to that feeling of emptiness, that feeling of why am I still living? Like, what's the point? It's taken my work life away. It's taken my family life in many ways away or reduced it. I can't do this. I can't do that. The Fiber Support Network is a way to allow you to feel a full person. Even though we're doing things virtually, it doesn't mean, if you approach or keep an open mind on the world of virtuality, it has actually been a great source of comfort for many of us who have bad days, can't go to in-person venues. Being virtual allows you to sit like I am. I do everything from the comfort of this armchair. And it's because I have chronic pain. Sitting up all the time on a hard chair doesn't help me. The days that I have fatigue, I do not trust myself to drive. So I don't like going out. So I like many of us with fibro, have had to cancel appointments, even with people with fibro, because, you've woken up and you have a migraine and you can't predict these things. They happen at random. So the virtual world, the virtual meetings have been a real source of comfort and a way of feeling useful and purposeful with daily living. So the programs we run, we have a whole set of exercise base. We have yoga, chair yoga, restorative yoga. It was run by a Canadian living in the UK. She would do her sessions there. She has since come back to Canada with her husband, and she's running them from here. But the point is, it didn't matter that she was in the UK and was a certified yoga teacher. She was still able to share what she loved with the community that she was a part of. We have it's called Mind Body Friday, where Kelly shares her passion and her expertise with mindful meditations and journaling. And we have Evelyn, who runs meaningful movement and stretching. And she did a course with a local university here in Canada to get trained to do that. And that's something she wanted to do. So we found a way to make it happen for her. And lastly, we have Leah, who recently got certified in Ageless Grace, because again, she wanted to have that. It was not her field of work, but she wanted to have that, to fill that desire to be able to teach an exercise class. And so we made that happen for her. So besides those exercises, which are offered weekly, we have a variety of programs, as Melissa mentioned. We have a virtual arts, where we have a different craft. It's not necessarily, arts is not just about crafts and art, but there's a whole spectrum. So we're again, educating, deepening in interest, deepening understanding and knowledge. I run a Mindset Matters. We have a soul to soul spiritual wellness. I mean, we've got in total 25 different programs that we offer through the month. And on top of that, like May, I'll be hosting our 4th annual speakers series, where we invite medical experts, healthcare experts, and advocates to speak to our community, and they would talk on different topics. So I usually have 5 in total over the month, that 4 to 5 experts come and speak on different topics, and we do from time to time different information sessions. For Canada here, There are certain disability benefits that you can get, which I'm sure in the States they're different, but similar. And so we get different support agencies come and speak to our individuals in person or virtual. Even tax benefits. We've had people come and educate our people so they are aware that these are resources that are in their backyard that they can tap into. And more with the virtual, being virtual, even organizations are operating virtually. So it doesn't matter that the lawyer in Alberta is speaking to us. The law is still the same when it comes to federal laws. And they now sometimes have cross licenses, so they can actually help people. An Alberta lawyer can help people in Ontario, for instance, if they've got the license. So you're making a big world, and a place that was very overwhelming for people with fibro, you're making it much more manageable and accessible.
Well, and building that community that we're all like looking for and getting involved, because we do get questions from people like, is there a support group in this area? And the beauty of being virtual is we get to connect with people that may not necessarily be in our backyard because, like you mentioned, there's different barriers to even get there physically. But that's this beauty of a virtual world. It's been fantastic connecting with people and being able to join groups if we can make the time zones work and all of that. But I do want to commend your group too for consistency. So every month I get the email newsletter. It has a calendar sent to me. It's well organized. I know when I can show up and attend. I know what the calendar looks like. And you even have a lot of information too. There's some tips in the newsletter. There's other upcoming events. I get lost with words on the compliment here, but I'm just really impressed because it is so well organized. It's consistent, which I think our community needs. And you've just continued to be consistent, and that's commendable because people need this consistency. They want to have somewhere to go to where, it's not always just about fibromyalgia, but it's getting involved with some of these other things that I've just loved your speakers too.
Thank you. And I want to stress a couple of extra points on these programs. What's unique about them is they're all run by people with fibro. I'm not running these programs. I just give people the opportunity. Every one of those programs that we started is because someone said they needed, or someone said, I'd like to. For instance, a member last year in getting feedback said, it'd be cool to have a program where we can bring our pets, and like a pet hour. And from that little nugget of information, we have a monthly program called Positive Therapy Hour. And it's nothing formal. It's about people coming online. It's not like they can't bring their pets, to any other program if they're in the background on their lap. We really, it doesn't matter. We even say, if you have to lie down and watch us, go ahead. Like, who cares? It's about us being able to function the way we need to function while, absorbing whatever the program is or participating. It's removing all barriers that have always been in the way. And so we have a program, related to pets, and the two individuals that run that have invited vet techs on to speak. And this happens at 7:00 at night on the eastern side, but, on the West Coast, the Pacific time, I said 6, did I say 6, 7:00? It's 3 or 4 o'clock over there. Right. So we try to make it so that all 5 time zones in Canada can still have it at a reasonable hour. And so the programs we run have spoken to a need, whether it's been a large need or a medium need or a small need. If there's a need and people are willing to run these programs, they run it. And I've always told every program facilitator has been told, this is a blank slate. Design the program the way you want. I'm here to be your support. I'm here to be your administration. You design it. If you feel you want to get speakers, fine. If you want to have different components, like in our Soul to Soul, we start off with a mindful meditation. We usually have a topic and we have breakout groups. And people love that concept because it allows them, to get focused and practice something we've been given as a tool in life to use with fibro meditation. We have a topic on anything in our spiritual awareness. It's not about religion, but it doesn't mean we don't learn from some teachings. But we the last one was talking about self-love, and how that's very important as a tool, and a self-care and self-love is a tool for us, because we as people with fibro are always our worst enemies. We're the hardest on ourselves. We live a lot of guilt, a lot of perfectionism, and most of us are type A individuals. We got here because we were type A individuals, which are the leaders, the superchargers, the overachievers, the ones who can't let go unless it's done right. Or your lines fit the drawing that you haven't colored outside the lines. Like, that's kind of how we have been brought up. And so we have to do a lot of unlearning and relearning to adjust to life with fibro, and because that's our new norm, that's a reality. So we talk about all these different things on a very candid level. We have breakout groups, so there's a bit more intimacy, and it allows people to build some relationships, because that's the other goal, is for you, Melissa, the participant, to realize not only are you not alone, but you can have friendships. You may have had friendships before that have gone by the wayside because you live with fibro and you're not as accessible as before to friends in your life. But here you have a community that can be accessible, even though you may not feel attached to a person ever. You're in the States and I'm in Canada, but yet you and I have forged a relationship over 5 years or more. So, it's doable. It's just changing a mindset and the approach.
Well, and then understanding too that you're surrounded by people that understand you. So even if you were to join groups with your camera off, you don't get the same pressure you do with some of the other groups I've noticed in the real world. Like, everybody got to turn on their cameras and be hyped up and get excited. So that's not this expectation. So, you come how you are, and who you are is presented here, and you're able to like try other things and have that experience as well. And speaking of the type A personality, though, I want to celebrate your openness, because you're having other teachers and people that want to share their experience also lead, which is tremendous as a leader in actually having that opportunity and allowing other people to lead groups as well. So I just want to celebrate that. I just take a moment to recognize that even as type A's and trying to control things, it's still allowing other people to lead.
And the thing is, I know for a fact, when I had that diagnosis and those first few years of coming to grips with reality, in honesty, it's like, what do I do now because of the skills I have, the learnings I've had, I have the education I fought to achieve, the ladder I started to climb. They're useless now. And to be honest with you, now after 20 years of being with this illness and living it, I realize I have a purpose. And my purpose now is to help serve the people in the fibromyalgia community. And the one thing, by allowing people to, empowering them really is the word, empowering people to become leaders, you're either nurturing people who are leaders and giving them a chance to enhance and continue those skill sets, and so they feel useful. You're also opening the door to people who may have wanted to become leaders or who didn't know they could be leaders. And you've given them, with encouragement and nurturing and mentorship, you've given them a chance to realize, I can do this. I can lead a group. So how many of us have had thoughts in our minds where, oh, I could never do this. I could never speak in front of when I was working, I always told my bosses, oh, I have a fear of the microphone. I didn't think I could speak in front of a crowd because I thought that what I had to say, wasn't worth it. And, I wasn't as educated ever. I don't have a university education. So, I was looked down in a university institution that I worked at. So you felt second class, not like you were equal. And forcing myself into this world. And like I said, we had to pivot. We had to use Zoom. It has made me very comfortable. And I've always believed in openness, because I think that's true sharing that makes it a meaningful dialogue. Those are some of the principles that we embrace, with our programming. Another thing we're very proud of, and David Wilson is our group manager. He focuses a lot on our the supports, the sharing circles and the support groups. And one of the big things that I should give him accolades was, here's an example. He he was a Red Seal chef, and he lost that skill, and had to give up his career. But he's taken those leadership skills he's got and his ability to make connections, and he went to the Southwest Ontario runs a program called Living a Healthy Life with chronic pain. He attended it as a participant and was invited to be a facilitator. And from that, it percolated in his brain an idea of, what about the fibro community? Couldn't we use the program, and can't the fiber support group support network offer this as a free program? And that led to us talking to the powers that be, but also to Elaine, who's 82 now, and still helps facilitate a 6-week session. So they provided us with the materials, they provided us with the training. I do the recruitment through, the ads and on social media and through our website. And so we do a bit of the coordination behind the scenes, but the education that the participants receive is all through the training of Stanford University's book called Living a Healthy Life with Chronic Conditions. So this is how we've been able, and every time we offer it, which is 4 or 5 times a year, we get about 15, 20, now sometimes even 25 people registered to join. And we're the only ones that do it virtually. They do a lot of the in-persons for other conditions like diabetes. But the one we run, which is on chronic pain, we now have grown from 2 facilitators to 2 more people from the Fiber group who wanted to become facilitators. And we've given them that platform to do so. So we've grown that, and they are really happy with this partnership that we have. So that's an example of how we've spread our wings, so to speak. The newsletter, and I really appreciate your compliments. The newsletter is one of our newest projects, and that I wanted it. I've seen a lot of different newsletters out there, and they're all great, but I found it very focused on illness. And the message I want our community to get is, we're fibro mates, like classmates. We are in this together, but also our lives are more than just our illness. So it's about learning about each other, and so I profile someone every month, from randomly selected from all parts of our globe. We have, there's some education on illnesses like the toolbox and what's in your fibro toolbox. We also have a section now. I just started a segment in a newsletter called Learning About Comorbidities, because we don't speak enough about, we focus a lot on chronic pain, but we don't necessarily talk about POTS or fatigue, and give people a bit more in-depth knowledge about these things that you could be experiencing that are linked to fibro. And Irene, she is a assistant professor from one of the universities, and her expertise has all been in ethics. So when she joined us, I think it's now maybe coming to 2 years, she said she wanted to share her passions, and her words to me most recently was, I think I found my calling, because she realizes that this is now the new way for her new norm of how she can give back to the community, how she can share her professional skills of writing. And so she opted to run a writing class. So she runs a writing program every 2 weeks. And we are building budding authors. That's what led to the book. I had the idea, she had the talent and the expertise of pulling stories that the contributions to the book that resulted in 50 Shades of Fibro. And it's really an anthology of a chronic invisible illness. And you'll see that reflected in all the stories. And they're very motivating stories. They're moving. Yeah, some have the struggles people have gone through. But that whole venture last year was a lead up to celebrating our 10th anniversary in November. But by that process, we got to know about Dale Rockwell, who is a photographer, who was a senior management person in the UK, who had to go through the struggle of giving up his job and trying to find something, and something new for his life. He developed a love for photography, and now he goes around taking photos as his therapy, and he shares that on his blog called Fibro and Photos. And we made connections with 5 different bloggers, all who had fibro. So you're just sort of opening up the world, and you learn from everybody's stories and everybody's experiences, some of which you resonate with and some of which are life lessons to learn from. But the bottom goal, and this is to all your viewers, there is hope. There is life with fibro. It's your mindset has to change from fibro's taken everything away, but it might have been opened the door to many new things. I'm grateful to have fibro because or the experience of having fibro and that might sound absurd to many of your listeners, but I found that because I had fibro and had to give up my job and stay at home, I was able to participate in my son's life in his teenage years. I was able to be present for all that and his university years and being a support here at home for him. And he's thriving in his career. He's grateful for that. I was able to experience all that, which I would never have been able to do at all if I was working my full-time job. Would not have been able to do that. We live on one income, or had lived on one income. My husband's now retired, but we made it work. I'm very thankful and grateful to my husband, who's my rock. He's in my life. He does 99% of everything in the house in terms of keeping up appearances, cooking, etc. I do things that I can do sitting down here, management of stuff, ordering things that, he really has no interest in, but I can still do and feel that I'm still giving back. Yes, I travel. In my next trip, I'm really excited to say we're going to see the polar bears in Churchill, Manitoba, the polar capital of the world. It's a bucket list item, and he knows, my husband, as much as he doesn't want to do these things, he feels an obligation to follow, to look after me. But we take into consideration an extra day here to rest. The things I need to take with me, like my seat cushion. If I have to use a walking stick, I'll use a walking stick. I'm got to put my ego away and my vanity away, and use the tools that are around you, or ask for things. Ask for a wheelchair if you need one. Ask for a walker if you're rent one if you need one. There are things out there that can help us. We just have to not be obstinate or too proud or too vain about using these things, because it can be done. It's just not the regular route of doing things. You just have to plan around it to accomplish a goal. So I'll be spending 7 days flying to Winnipeg and then to Churchill, Manitoba, and we have 5 days to go look for polar bears during their peak season over there in October. So I'm looking forward to that.
Oh my goodness. I can't wait to see the pictures. That's going to be an incredible experience. And I'm glad that you're bringing joy into your life. And that's a huge takeaway for everybody to understand. And you've said so much too. And what fills my heart with what you've discussed and what your group is doing is that I've always dreamed of a place where fibromyalgia patients can go to find some healing and connection in this community spirit, because we can learn from all each other in our experiences. And some of the work, so I know from my own personality, and everybody out there knows, I'm very nerdy. So it's been a challenge. And I think I need to take a master class from you in leadership, but it's been a challenge to go. I've been searching, I was like, where is the other place? Because a lot of the work we do here, it's like the warrior, right? So we're on the steps of Capitol Hill. We got to get this research, or we're in the research. My brain is deep down into the scientific research. And that's not a place for everyone to go. As I appreciate the warriors coming with us, we're advocating, we're getting to the representatives and all that stuff and doing the research and training the medical providers. That can be an intense place to exist for a lot of people. So I've been searching for a place where people can go and just get into crochet or get into having their pets. Like all of that really is a dream come true to actually see a place that patients can go to. Is that you can't live in a warrior space like I
Mhm.
have forever, or just even that may not be where people are at right now. They want to just find something else to do and to live a life, bring more joy, travel.
Yes.
So it just fills my heart to hear you talking about this because I love it. I want to encourage people to join as much as possible. Please definitely do this. And we're going to be
Thank
promoting
you.
this
Thank you.
content.
Thank you. I should say that, because we operate, and of course, there are costs attached to operating on a virtual platform, running a website. We ask people for a membership, an annual membership fee, which is really nominal, $20 a year in Canadian. It's 15 in US, and in sterling pounds, it's 11. Um, and we asked, you can mail us a check or email it as an internet transfer. But I want people to know too, if you are facing financial hardship, as I said at the beginning, we are a very inclusive group. No one should be left behind. So if you are facing financial hardship, and some people are, and that's their reality, you just have to write in and let us know what your circumstances are and ask if, you want to request a waiver of the fee. We're not here. It's not about making money. It's about getting resources out there to the individuals, wherever you might be, providing you with connections. And most importantly, is giving you that patient education we don't get even from our own family doctors. Everything I've learned about fibro has not been from a doctor, but it has been from all of you. Through your experiences, through your medical experiences, through learning that, POTS, I never knew POTS was one of the, I'm still learning what POTS is. I don't have it right now. So I say right now because I don't know what the future holds, but I understand now what that illness is about. And I realize it's a comorbidity of fibro. And so I educate myself so I'm in the know rather than caught, left field and ignorant about things. So that's one of the things, people with fibro, you have to become your own advocate. I think, Melissa, your experiences, my experiences in terms of pushing the case of fibro and getting it being taken more seriously by doctors, and that no, it's not all in our head as in it's a imagination. It is in our head, but it's related to neurology. That's what we're advocating now is, through what Melissa's doing, through trying to push for education with medical practitioners, the healthcare industry, the medical industry as a whole. It's about we, the people, empowering ourselves to bring these things to others. They have to sit up and listen. One of the things we created, and I'm happy to share that with anybody who will request for it, is a fibro symptom industry. I thought I have it here, but I don't. It's a 4 pages of things people experience. It's put together from information from people with fibro. It's not created by doctors or nurses. It's created by people with fibro. We collected all the symptoms and collated them into different sections. But all it is a tool to help people with fibro go when they visit their doctors or specialists or nurse practitioners, to have a tool with them to say, this is what I'm experiencing. Because it's so, I know I've experienced this. I walk into a doctor's office. I'm not afraid of him, but whatever I want to say to him goes out the window. And if I don't have a list, or if I don't have something in my hand that has, things I want to talk to him about, half the time I miss talking to him about certain, or I forget after the fact. You're in the car and you say, oh, I was supposed to talk about this. I was supposed to mention this, forgot about it. So this tool allows them to express they're feeling this and that, not just I'm feeling fatigue, but I'm also feeling, these other symptoms along with it.
I love it. I love it. And we're going to be sharing all these resources with people and just even future collaborations because I have a lot to learn from you in helping patient services and just future collaborations with getting more of the patients the information you need. You have wonderful speakers too, and all the work. It's just we have to collaborate with each other in order to accomplish things moving forward and just supporting patients all over the world. Because I know we get a lot of international comments as as I know you do too, and everybody's asking questions. So we're all looking towards each other. And I
Yeah.
know everybody's looking at the United States to also figure out what we're going to do with all the changes
Sure,
that are
you've
happening.
Melissa, I'm sure you've had this feeling of sense of self-accomplishment and satisfaction when you learn you're helping someone from the other side of the world, that you've become a resource or become a go-to. And that's not about, patting yourself on the back. It's just that realization that here I am sitting in Arizona, in a place, I'm not sure if you're in Arizona right now, California, but I'm able to help make a difference in someone's life. It is very profound when someone comes up to you and says, I was about to commit suicide because of this illness, but joining your group has opened my eyes to the possibilities, has given me that connection that I was longing for. And I don't think that way anymore. That's a profound thing to realize the impact you have on people's lives. So to all your listeners and to you, Melissa, you are a leader in many, many ways, and one person that I respect. And
An
I want to say
introverted
that here
leader.
too. You may be nerdy, you may be introverted, you're still a leader, my dear, because you have decided, for you and me, we've stepped out of our comfort zone. We've stepped out of the box around us. It's much easier to stay in the box, but it's more challenging to step out. But by stepping out, we both have grown by leaps and bounds in ways that would not have been possible if you didn't have this illness, because it's our illness that has forced us to look at life differently, appreciate things differently, and start pursuing things in new ways and novel ways. So I applaud you just as much for the inspiration you are to so many people. And I mean that from the bottom of my heart.
Oh, I appreciate that. And I learned a lot doing our fibromyalgia community conference, which we have to figure out how to collaborate on in the future.
Sure.
Because I know you keep really busy with the events too. But I saw like we had Carrie from Taiwan sharing what was going on with Taiwan and fibromyalgia. And then we bring in lupus spoons from Chicago, but they're all virtually connecting
Exactly.
on a panel together. We have India, like everybody from around the world. So you really then it gave me, I'm like, oh my goodness, we really aren't alone, even though we feel like
Yeah.
it. And then we start to connect with people in the United States, but then just the expansion to really see the grasp of everybody internationally and how much we are in this really together. And there are people doing advocacy in other countries. So it's all just supporting us. And that was really a big thing for my takeaway from that
Yes.
community conference.
And to me, that conference spoke to one big thing. What we are all experiencing isn't just a North American issue, isn't just a US issue. Okay. It's a global issue, and it needs to be treated as that. It's a global rising medical issue, because the numbers aren't getting smaller, the numbers are getting bigger, and more people are realizing, and that's the reality of the 21st century. Fibromyalgia is real, it exists, and we need to awaken, and the resistors need to stop resisting and accept that yes, it is a real disease. It's not all in our head. It's, as I said, it's in our head, yes, in our brain, in our neurology, but not in our imagination. It is a quandary. It still is somewhat, but yes, there's a lot, and we need to also applaud the researchers who have taken a vested interest, the medical specialists who have taken an interest in learning about fibro. And I hope that some of the listeners to your program will be inspired to pursue, a medical, if they're so inclined to doing research based professions, that they would consider trying to find a cure, or trying to find a root cause. We still haven't discovered what the root cause is. They're getting closer, but they still haven't discovered it. So there's still lots to be done out there, but it would be lovely knowing that this is a global issue, that we collaborate. As you and I had an earlier conversation, stop competing with each other. Let's start collaborating instead. And in this world where there are lots, like in what the US is experiencing now, and even I think every country in the world is experiencing cutbacks, inflation, possible recession, we have to do more with less, is what a lot of us have to experience. Well, one way of working on that is by collaborating instead of competing, because when you collaborate too, you can bring more people together, and the power of our voice is in a unified one.
Well, and we can play to our strengths as well. So each of us have
Exactly.
our own strengths rather than stress us out with stuff that's like overwhelming or, maybe is not necessarily our strength, but we can lean into all of our strengths and collaborate and support each other. And I'm glad you mentioned supporting the researchers that have gone and continued to research fibromyalgia. That is a big deal because I've heard from some people that they do get discouraged. Like, you shouldn't even bother. That's not where the research should go. So I'm really glad that a lot of these researchers that are still in this have stuck to their guns, and have continued, even with small cohorts and
Yes.
limited funding, they've continued to pursue this for fibromyalgia. So we're all about supporting them, and even medical providers that are coming forward to talk about it, to educate. We need to just keep supporting them and keep encouraging other people to get involved. So exactly what you said.
And I want to just tag on to two words you just said: get involved. Getting involved can take many different forms. You and I have chosen, and our what we've done has led to leadership roles, and more importantly, mentorship roles in our lives. And everybody should get involved. Everybody should have a vested interest in this fibro community because we are part of it, and take ownership in that, and you have a stake, whether you like it or not, you have a stake in the fibromyalgia community. So how can you give back? How can you participate in the life of this community? It could be running a program. It could be helping out with advocacy. It could be small ways and big ways, it to your capacity. But the point is, you have a new normal, and you can still be a functioning adult, a functioning person that has still got a lot of value and purpose by participating in the life of the fibromyalgia community. And it doesn't matter whether you're in Australia, India, Africa, you still have. One of the programs we have is fibromyalgia support in Arabic. Again, this happened because, see, to me, it's the divine intervention sometimes. I have to tell you the story. Khalud is Jordanian. She migrated to Canada, and her story was in one of our, actually is in the book. And she tells the story of her life. She happened to run the Jordanian. She faced the same struggles there. Doctors who don't believe. She finally met, after, challenges, she met a specialist who actually invited her or suggested that she start up a support group. And she had and they wanted to register the company, but the way they have the process, they have to have evidence backup and all that for the need to incorporate this organization. And so she was a part of that whole process. And that gave her purpose and life. You know what I mean? The reason to get up. And so she ran the Jordanian Fibromyalgia Association. She migrated over here. She felt a loss of connection, loss of her, people, her community, her Jordanian community, her Arabic speaking. And then she learned about Fiber Support Network, connected with me, and offered herself up and said, I used to run the Jordanian, and so, any way we can help. And I said, you know what? We have people that speak Arabic because it's their first language. We have a population of immigrants. We're all immigrants at some point or another in our family tree. I said there are a lot of Arab speaking, and I know there are a lot of programs out there in other capacities that are offered in native languages. And I said, would you like to do one? And she said, sure, let's do a virtual fiber support in Arabic. And she's using her Middle Eastern connections to of doctors and healthcare professionals to speak to populations. And her program reaches Europe, parts of Africa that I didn't even know exist, or knew that exists but didn't think we would connect with. People from Egypt, Jordan, you've got Saudi Arabia, Rwanda, like different countries all over Africa. You've even gone as far as France, because there's an Arab speaking population there too. So, it also forces you to realize that it's not just in Canada where you have immigrants who speak African. African-speaking immigrants are all over the world. So it broadens your mind, just the global outreach, the geographic outreach. But that's an example of thinking outside the box. And so she has that freedom, and because she has led before, she understands, what kind of information she wants to get out there. And so she runs that program. And, we're very flexible because right now she had an accident when she was visiting Jordan, resulted in an operation. And so she is recovering from a foot surgery. So we've had to put the program on hold, but it will start back again in September. So we also adjust to people's health issues. Sometimes we have to cancel class or postpone it or stop a program temporarily and start it up again. And so we're very flexible that way because people in fibro understand. We don't predict these things. I could be going through a flare up that lasts not days, but a month, Like you told me you are preparing to have a bad flare up. After you graduate.
Yeah, might have to disappear for a month, but I think I might just be so energized. Just have to get through graduation because the purple hair will come back. I'm telling people like May 26th on that graduation stage, I will be purpled. I will be ready to go with the degree
You
in
gotta put
hand.
purple lipstick on too.
Yeah, I will be. They will see because I've had some of the students see my profile picture and they asked about the purple hair. I can't have it in clinicals. It's a rule for dress code for uniform, but I told them it is coming back on graduation day.
I want to point something out with your own experience. Have you realized that you've actually brought the world of fibro to your whole class, who probably, there would be some, if not all, because they're much younger, have not heard of fibro, or they may have heard the word but don't actually understand what it is. And you have brought indirectly and directly an awareness. And that's what all of us can do in our own ways. I never shy away from saying I live with fibro. I don't care whether they know the word or not, or they know, understand. Sometimes I say, do you know what fibro is? They say yes. Even when I go traveling, I go up to the agents and I say, I have fibro. I can't stand in line. I have chronic pain. I can't stand in line. I need to board early. And I have not yet received the resistance. Making people aware about the sunflower lanyard, which I've talked about in the newsletter and on different platforms. It's so useful because that allows you not to be embarrassed. It tells the people, the different frontline people in an airport that's participating in the program that you have an invisible illness. They don't ask you what it is that you have, but they know you need accommodations. So, you get pushed to the shorter lineups, you get pushed to the paralegic line so that you don't have to be in a lineup too long. You get to board planes earlier. You get to ask for, not that you can't ask, but when you get wheelchair assistance and you look great, people don't think twice about it because they understand you have a need, that you need accommodations. And these are the tools that you put to use that benefit you. And you have to let go of your ego to be able to do all that. The ego that says, I'm above all that. The ego that says, I'm not one of them. Who cares? You won't see these people again. Why does it matter?
Well, into my classmates, in nursing school, I have my fibro nerd shirt on. I wear it is on my sleeve. They know. And I'm okay with that. Even my professors, I've been talking to them and I've been sharing. I was a little hesitant because I didn't want them to see that as potentially a weakness, but I'm sharing that I'm an advocate. I have fibromyalgia. And this is why I'm here, actually. This is why I'm here in the program. And so I've been teaching even my professors some things and understanding. And this is good because they're all nurses. They all work in the field. And then the nursing students also become more familiar with chronic illness conditions because one of their peers has chronic illness conditions. And then you find out there's some other students with other conditions who aren't saying anything. But it's good. It's good to be an advocate whenever you can.
Let me ask you this. I know I'm turning the tables now and interviewing you, but did you ever vision your life the way it is now? Do you think that if you had never got fibro, that you would be going down the path of trying to get a master's in nursing?
I didn't ever envision reclaiming some of this to go to nursing school. As a young kid, I've always loved medicine and science. So from an early age, I was already reading medical books. So I did want to go into medicine, but I don't think I would have been the same medical provider or even gone into the same field. I think I did want to help people like me because I've always been sort of struggling with health since I was young. The allergies and I was growing pains. I was always in the doctor's office. I just never understood where my place or purpose would actually land. So this feels right actually being in nursing because I've learned that the nurses are the patient advocates on the team. And I would have
Yes.
never understood that if I had just pursued medicine, like being an
Yeah.
MD, which is what we're kind of taught,
Yeah.
especially culturally. I was kind of taught
Yes.
this is all you can do. But now that I've learned the values of being a nurse, I'm like, I'm proud and excited to actually go into that field to help and be a better advocate.
Do you feel that the journey you've been on, the struggles and all with it, and the continuing struggles you'll have, like, the flare up days, the days where, because you have this, it leads you to this other comorbidity or other illness. In spite of all that, do you feel that you've grown? You can see when you look back and look inward at yourself, that you can see you've grown in so many ways that you would not have thought about or thought possible, and the experiences you've had in terms of emotions, in terms of knowledge, in terms of everything, the whole holistic view of yourself. Do you love where you are now, the person you've become, and the joy you find from what you're doing? Does any of that, how do you feel about all that?
Absolutely. I've had a lot of growth. I still have areas that I need to grow into. But I think I've noticed too, now that I get to work in person with patients in clinical rotations, that empathy, especially for complex conditions that have shown up, it's a different perspective than other healthcare providers around me. So interacting with the patient, the family, especially when they're in their 20s, we've had cases like that. And there's some skepticism around with the other healthcare providers, but it's good that I have more of a background of understanding, which is going to be useful moving forward. I still have areas to grow. Like I mentioned, that nerd of introvert is like too much, but I'm growing and learning.
But you see, you pushed yourself outside your comfort zone. A nerd or an introvert would not take the steps you've taken to grow outside your box. They would love to stay away from people. You're going in a profession where you have to deal, not that you're going into, but you're deepening the profession, and you're going to use it the way you're going to use it. It's not, you're not necessarily going to work in a hospital, but you're using that academic knowledge to further the pursuit of an advancement and advocacy for fibromyalgia and for the cause, which is fibromyalgia, in terms of the need for seriousness, more monies, and more research, and you I know, I to me, you should be a model citizen, or not, you should be, you are a model citizen, and I'm sure you inspire a lot of people every day by what you do. You've proven that you can have a life, a meaningful life, with fibro. You have to change your mindsets, that things are possible, and not take the defeated approach. You are a survivor. You are a warrior. When you look at the U.S. Senate and the battle it is, the battleground that it has become, you still go into the lion's den. To fight. And that takes a lot of guts and courage. And I thank you on behalf of the fibro community. I may not live in the States, but what happens there does impact other countries, because if it can happen there, it'll happen. You know what I mean? If something gets approved there or passed into law, and a regulation is changed, then it just snowballs to other countries to start looking at their own and what can they do better for the citizens. So you are doing great work, and you are serving a very big purpose.
I appreciate that. And leaning into the purpose is something that motivates me. And just, I want to acknowledge too the courage of everyone that has gone with us to Capitol Hill, because we were all out of our comfort zones in 2019 when we started that. None of us had done that work before, except for Looms for Lupus that joined us. So we were trying to lead the charge and continue this advocacy, which is important. And that really is, I'm encouraging everyone to get involved because our representatives do need to hear from us. It is out of our comfort zone for most of us, but it's important to talk to our representatives. And despite anything and everything that is happening, we need to do it. And it's funny you mentioned advocacy as well, because in nursing school, I've opened up that I might actually take some of our nursing students locally here in Arizona in August to do advocacy, because they're finding, they're like, wow, you're really passionate to train other people to do stuff. And I was like, oh, so I'm just like naturally getting excited about like, we got to train and like get people involved because it's so important. So yeah, there might be some update with actually getting some of the nursing students at the in the representatives for Arizona soon. And I think I'm the instigator for that. So
You do know you're modeling what advocacy is about, and you are inspiring those young minds to think differently about, you're going into nursing, but it isn't just about doing your job at the bedside of a patient or in a ward. It's beyond those. Your role goes beyond that. It's about advocacy, and advocacy takes different forms. It's not just about fighting the U.S. Senate. It could be fighting the hospital management or the ward management. The supervisors, and pointing out and speaking up for the people who can't.
absolutely.
So. And to be candid, as you were speaking, we all know the reality of today's world. U.S. is not the only one going through a very hard time politically. Europe has its own challenges. So do all the other continents. Where we're morphing into a authoritarianism. Is that the way I say it? And I'm not trying to make this political. I'm just trying to say that the messaging that you see is, it's the power of the people that can change stuff. You see that happening in the States now with all the protests. Many people may watch and say, yeah, where is that going to get them? It's about being heard and taking steps to to stand up and speak out. And that's what all of us have to do in some way, shape, or form. It could be stand up and speak out to your own doctor.
Yeah.
It could be stand up and speak out when you're at the hospital and you're in pain and they think you're there to try to get drugs, and just speaking up and out against that possible perception, changing it, if it means even educating them that, fibrom is not just about chronic pain. It's about this, that, and the other. I'm experiencing this right now. It's real. What do you want me to do? Like speaking out against it, demanding to see specialists if that's the route you have to take, and not taking no for an answer. That's all advocacy, because you have to advocate for yourself. If your gut is telling you something is wrong, keep pursuing it till you find the answer, because more often than not, doctors will say, oh, just leave it alone, or it's not showing up. But if your gut is telling you there's something wrong, pursue it.
I love your messaging, and you're so eloquent with words. So I'm so glad we got a chance to do this interview. And I know you have to go to something right at this hour.
Well, another program we're running, Mindset Matters, we're talking about emotional intelligence. So,
well, I'm so just glad I had a small portion of your time to share interview with everybody, all our fibromyalgia friends. We're going to have you back, and we'll be sharing all your content.
I'd love to. So, thank you so much. And I look forward to collaborating with you on a few different fronts for the benefit of the community.
Definitely. And just as we close out, where can our fibromyalgia friends find your organization?
They can find us on our website. Visit our website. You can actually, if you choose to become a member, you can fill out our online membership form. The website is www.fibrosupportnetwork.ca. It's fibro, Fibro supportnetwork.ca. You can also email me at admin, ADMIN, at fibrosupportnetwork.com. Okay. So the email is .com and the website is .ca.
And we'll be sure to put that in all the description notes. So It's been such a joy to talk to you, and there are going to be many future conversations. So thank you everyone for tuning into this interview.
Thank you very much. Take care. Good luck. Bye-bye.